All right. Good afternoon. So for those of you who don't know me, I'm Heather. I kind of fill in wherever I can. Today, Amy is doing a bunch of interviews, so I am currently her fill-in to see if we can help out today. So today we're here for pies and planning. In case I know a couple people had called, we do actually have pies, which is kind of cool. So our pies were donated today or sponsored by the Whitney Place. And in addition to the pies, which I will be walking around with in a moment to make sure everyone has one, there's two options. There's, I believe, pecan, and then there's cherry. They also had two handouts, and one of them I think you got in your packets when you picked them up, which was this. It's one of their upcoming events over at the Whitney Place. It is I Left My Memory on a Bus Somewhere, a bittersweet journey through Alzheimer's disease. And that is on February 12th at noon over at the Whitney Place. So if anyone didn't get a flyer, they'd like one, it's here. And the other thing they handed out was just a complimentary lunch voucher for everybody to take. So today's presentation is going to be by Ellen DiPaola. So not close up. Ellen DiPaola, and she's here from Honoring Choices, so she's going to go through her presentation and leave some time for questions. We're also recording this for broadcasting later through cable access TV, but they're going to focus just up here on the presentation. So if you do have a question, you won't be on TV unless you really want to be, and then you can come up. But that way, everyone who's not able to make it today can also benefit from the great information we have. So I'm going to turn this over to Ellen, and I'm going to come over and walk around with pies, and anyone who just came in, I'm going to bring you guys some handouts. Thank you very much.
So we can get started. I have this right. Okay. So everybody can hear me from the back? Great, good. Well, welcome. It's a lovely place to be. I'm here with you today. I'm Ellen DiPaola, and I'm the president and CEO of Honoring Choices Massachusetts. So what I'd like to do today is to tell you a little bit about the organization and talk to you about making your own plan. We have some basic information, and then we have some information for the future as we go. So I want to invite you all to make comments, tell me what this is like in real life, trying to make sure you get your choices honored for care, and ask questions as we go. Sound good? Good, and please eat your pie. Excuse me, I'm actually a guardianship attorney, and for a long time worked in the state, usually helping couples where, let's say, the gentleman in the couple had lost his ability to make decisions from a stroke or from an illness. And because that gentleman had not done a 5-minute healthcare proxy, a 5-minute document, to appoint, say, his wife as his healthcare agent, we now had to go to court into a guardianship proceeding. Because how this works in Massachusetts is we appoint our agents. You know, we think it's incredibly strong for you to keep your right to say what you want for care. And the way you pass that, as you may know, is you need to do that while you have the ability to do it, and you pass that right through a healthcare proxy to say, I'm going to appoint this person I trust to make decisions for me, healthcare decisions for me, if one day I can't do that, even for a short while, even if I have pneumonia for a few days in the hospital. My agent then has the power to step up and talk to my doctor and help make decisions if decisions need to be made to get me good care. So because that gentleman hadn't done that, we want to respect the fact that he still has a right to say what he wants for care. So we have to go to court to a guardianship proceeding. Well, the judge will now appoint someone to be a guardian to make those decisions for us. If we can avoid that process, it's nice to do. And one of the things I learned as an attorney is many people didn't even know that that's all they had to do, was to do a 5-minute healthcare proxy. That they could do it themselves was news too, that we really didn't need a lawyer to do your own proxy. And that how then that document worked with 4 other planning documents in the state to make sure we were protecting everybody's rights to say, here's what I want for care. I've talked to my family, I've talked to my friends, people who are important to me, I've thought about this. This is what I want. So that's what we're going to talk about today. And what I did as an attorney, I was just frustrated with the fact that most of the state didn't know this. So we closed the law practice and we started Honoring Choices as a nonprofit. And the purpose of what we do is to make a healthcare plan to get the best possible care. So what you're going to hear today is something a little different from what actually we've been telling everybody for years, that to do these documents and then just kind of put them in the drawer. Don't think about them anymore. In fact, that doesn't help our doctors know what we want for care. So what we've been doing across the state is saying, yeah, do those documents and then go to your doctor and say, here's what I want. Let's put it in my medical record and let's talk about my care. Because this isn't just about future care, but it's how are you feeling today? How can we get the best care right now? That's what our program is about. So our mission is really simply, it's your health care and it's your choice, that everybody has the right to really take charge of their health care decisions to say what they want now and in the future. So that's what we do. We have a lot of information to inform and empower adults of how to make that plan for themselves, how to change that plan, how to make it a really dynamic process, and then make sure people are getting connected to care in the community. That's a lot of what we do at Honoring Choices. And we simply say this, everybody's on a healthcare journey, right? We all want the same thing, to get the best possible care, whether we're just working on feeling good every day, whether we're managing chronic illnesses, or whether we're living with serious illness and at the end of life. So it's a healthcare journey, isn't it? And we just think everybody needs a plan. Really simply, it becomes this really powerful roadmap to be able to say to your families, here's what I'm thinking about. To say to your doctors, here's the kind of care that I want. And it's written down for you in a plan. And we've learned simply making a plan really helps everybody. It certainly protects you because we know that accidents and illnesses, they happen every day. My 18-year-old boys, who didn't at the time have a healthcare proxy, used to play rugby, a nice gentle sport where they smashed their heads together. And both of them went to school outside of Massachusetts. And we didn't think about healthcare proxies at that time. It was a bit of go. So they'd end up, knocking their heads together, not being able to really talk to the doctors about anything about their health care. And they'd be in a hospital in another state. So I'd get a phone call from one of their friends saying, oh, Dan's in the hospital again. It's like, great. So when I tried to talk to the doctors and the nurses, they said, we don't know who you are. We understand you're the parent, but you're not your child's healthcare proxy. So we legally cannot give you information over the phone about anything about your child. And that's true. That's the law, because I could be anybody as far as they know. So we learned really quickly that even at 18, when you're healthy, you need a healthcare agent sometimes. It's really just part of life. So as we say, it protects you. It certainly supports your family to know what you want for care, and it helps our doctors know what to do. So at Honoring Choices, we just thought, look, let's make this less confusing, because I was aware that the doctors were using a certain kind of language for advanced directives. Families were using a different kind of language, and we just weren't communicating. So we said, let's make it easy. Let's look at Massachusetts law. Let's look at the words in our own law, in our own Constitution here, and then say, let's all use the same thing. So we developed a quick and easy approach for healthcare planning. And what we want to invite you to do today is to look at it like this. And as you talk to friends and family, you can also help them do the same thing. Is to say, even before you start planning in documents, think about where you are in that journey. What do you want for care? What are you most worried about now or in the future? Think about that, and then what information do you need to actually make choices for care? We find as we talk to people throughout the state, that's the biggest problem we hear is, I just don't understand enough about my illness and my my outcomes, to know what kind of choices to make. So getting information is really a basic right for everybody in this state. It's really okay to say to your doctor, thanks for telling me about my illness. I'm going to come back next week, and here are the questions I'm going to have for you then. Let me go talk to my family. Let me come back and let's talk about it again. Even though our systems are not set up for that, that's your right to do, to keep getting information until you feel like you have enough information to make decisions. So we want you to think about what's right for you. Then we're going to talk about these 5 care planning documents today where you can write down what you want. And then, as I said before, this really is about feeling good today, right now. How do we talk to our doctors about what we want, those care goals? What's your values? What's your priorities? That all makes up what you want for care. So that's our connect piece. So we put together this program called Who's Your Agent? It's been very popular right throughout the state. It's got 2 toolkits. You have in front of you the Getting Started toolkit, and it's also very easy to get on our website and download it for free. But both of these kits we use to keep talking about healthcare planning from when you're 18 right on up through life. So let's talk about those 5 documents and see what questions you might have. There's a lot of misinformation about these documents out there. We're going to give you the best information we have today. And as I say, this can get to be like a lot of information today, but all of this is right on our website. Okay, very easy to find. So the Getting Started toolkit, we wanted everybody to just get started with 2 simple documents: the healthcare proxy and what we call a personal directive, but it's known in the state as a living will. Have we all heard of living wills? Yeah, and some of you, I would imagine, have already done the healthcare proxy. You don't have to raise your hands. It's really very personal. But both of those documents are what we like to start with, and we'll talk about those in depth today. But generally, what's a healthcare proxy do? One really simple thing. I just pick a person to be my healthcare agent. That's it. I'm just picking someone, and I'm giving that person the power to make decisions for me, healthcare decisions, if I can't do it myself. But that's all that document does. You're just choosing someone. So the question is, how do they know what to do for you? How does that agent know how to make decisions? Well, that's where the personal directive comes in really handy. And if you haven't done this, I would absolutely urge you to do it, because these documents work together. So I appoint my agent in the healthcare proxy, and then I give my agent instructions for the care that I want in that personal directive. So you can see how important they are. In Massachusetts, that's how we work it. We have 2 different documents that work together. Questions or thoughts so far?
Does your healthcare proxy have to live in Massachusetts also?
The person does not have to live in Massachusetts. It is easier if you have somebody close by that you can name as an agent so that they can actually go to the places where they need to be. But we can talk more about that. It's a great question, and as we go, we can talk more. Yeah?
What about minor children
What about minor children?
and grandchildren? At what age would you recommend that?
That they do a healthcare proxy? Yeah, so a healthcare proxy, the law says you can do it 18 years old. So we absolutely recommend that children and grandchildren do it right at 18. Because again, all we're doing is saying, this is the person I trust and want me to be my healthcare agent. Now, the moms and dads in the room want their name on that document, but it is up to the person to do that. It's a good question. So the next 3 documents, which are all on the website, we like to think about this as a plan. You've got 5 ways to communicate what you want for care, but you don't have to use all of these documents. Certainly the first 2, the healthcare proxy and the personal directive, they say a lot about you and they're good to have. The 3rd document is a durable power of attorney. I don't know if people have heard of that, but it's a legal document in Massachusetts where I name a trusted person to make financial decisions for me, right? So a little different. We split these up. The healthcare proxy is a trusted person to make all healthcare decisions, right? And the durable power of attorney is a trusted person to make your financial decisions. Good person to have. If you're not able to do that for yourself, you really want someone to be able to step in, keep your money safe, your estate and your houses safe, and then to be able to get money out of your own bank accounts to pay for your care. It's a really helpful thing to do. You do that with an attorney. You don't have to, but we absolutely recommend it. Those last two documents are medical documents that you can add to your plan if and when you need them. So we've heard of a do not resuscitate order. Yeah, and the state name for it is Comfort Care Do Not Resuscitate, because what it says is this is a medical order you do with your doctor, okay? So you can't do this one on your own. And the doctors like to do this when people are either have serious illness or life-limiting illness, or they're just frail. You go and sit down and you talk with your doctor. If this is your wish, you say, look, tell me about my health, tell me where I am right now and my prognosis. And if at this time in my life, my heartbeat and my breathing stop, I don't want you to try to resuscitate me. And that's your choice. You can make that choice if you want to, or you can say, absolutely resuscitate me. Give me everything you got. That's your choice in life. So the do not resuscitate you do with your doctor if you want to. Sorry, can you do it with a lawyer? No, you can't do a Comfort Care do not resuscitate with a lawyer because it's a medical document. So it has to come from your doctor. It's a medical order from that doctor. Does everybody have a different, I'm sorry, I'm just going to repeat questions for our cable audience. Does everywhere you go have a re-sign up? Yeah, it's a good question. So the Comfort Care Do Not Resuscitate order that comes from the state. So there's one state document that can be downloaded. Now that's the one that when EMS comes to the door, they look for that order on your refrigerator, on the back of your door. Now if it's the state one that says do not resuscitate, then they can follow it. Now here's why this is a great question, because sometimes when you go to the hospital, you'll talk to the doctor about, let's do a do not resuscitate for me now, because maybe there's a surgery or something upcoming where that question might come up. Now, as long as you're in the hospital, that do not resuscitate order is in effect. But the minute you leave the hospital, it typically isn't. And we know from what EMS has told us, the emergency services, the 911 folks, they can't follow that order because it's different, as you point out, from hospital to hospital to hospital. So doctors know this, though. If you want a do not resuscitate order that everybody can follow, and when EMS comes that they will honor, then you do the state form. And your doctors know that one. But it's confusing to some folks because they think, well, I just had that surgery, and I got to do not resuscitate at the local hospital, but it's not in effect anymore. And our EMS folks tell us it's a big problem. There's a lot of confusion that people think that that's still valid.
So the one you do in the hospital is only good for that one incident, the next time you go in, they'll want a new one?
Typically, yes, it's only good for as long as you're in the hospital, but again, this really varies hospital to hospital. Every hospital has their own policies and procedures, so as patients, you have the right to know and to ask. If you're there and there's a do not resuscitate order, I would ask about it right away. I'd say, what is this order? Where did it come from? How long is it good for? Yes, sir.
So if we want to do the state one, so we're telling us, where do we know to get that?
So where is the state form? So the doctors have it. We don't get it. I mean, you can look at it. That's the most form is the pink one, and we'll talk about that in a minute, right? Yeah, you can go online, and if you go to the Honor Choices website, under the resources section, it talks about the DNR, and it shows you a sample of one on the state website. So you can look at it. But again, this is a medical order, which means your doctor has to do this with you. Okay, so you can all feel reassured that if this is something you want, go talk to your doctor and see if it's time for you to do that and what they think about that. Yes, ma'am.
and you go through the admitting process, what do they give you?
So if you're going into the hospital through the admitting process and you're going into surgery, they do often give you lots of forms to sign. And you get to stop and say, what are these? Again, you're not forced to sign anything, but they need your consent in order to do procedures. If you see a healthcare proxy as part of that, again, that happens. And if you already have a healthcare proxy, you can say, look, I don't want to do a new one. Here's who my agent is, and here's their phone number, because you already have a proxy. But it doesn't hurt sometimes if you want to refill one out in the spur of the moment there. Just make sure you're putting the same person's name and phone number down. Now, if you want to talk about a do not resuscitate, they shouldn't be just giving you that form. That's a conversation you need to stop and have when you're comfortable with your physician about that. Does that answer your question?
Is that required when you go into surgery beforehand?
Is it required before surgery? The thing about these 5 planning documents, these are absolutely your choice to do. They're voluntary forms, and it doesn't always feel like that when you're under pressure. But to be able to say, wait, hold on, if that happens to you or someone you know, to say, we need to talk about these. I just can't sign them without having a conversation about my health, about the risks and the benefits of having CPR and not having CPR. You need that before you can make a decision, right? Sir?
Just trying to get this to simplify my brain. If you do the personal directive and the medical orders, will you cover most or all of what's in the comfort care?
Yeah, that's a really, no, and this is confusing, the 5 documents. So let's just give you a sense of how they work. If you'll allow me to talk about MOLS first, I think that might help. The question is, how do all these documents kind of work together for you? So let me talk about the MOLS form for a minute. The MOLS form came into the state about 8 years ago. And what we did is said, we tried to make the discussion around serious illness choices, what happens at the end of life, get put into one form. So the DNR, the do not resuscitate, just says one thing, right? Don't resuscitate me. The MOLS form takes it much further. So in the MOLS form, and again, there's a sample on our website, the first decision in that medical order is, do you want to be resuscitated? And then you can make other decisions, like, do I want to be intubated? Do I want air to keep me alive? The third decision is, right now, it's a question of, do you want to be transported to a hospital, or do you just want to try to be comfortable and die in place? And that's typical for people who have long-term illnesses in nursing facilities who keep bouncing back and forth to the hospital, and how uncomfortable that is. So those are 3 decisions in the MOLS form, but I want to say that you don't do a MOLS form with your doctor unless you've been diagnosed with a serious illness. So it's not for everybody. If you're healthy right now, you can't do a MOLS form. And that's why that personal directive is so important to do, right? Because in the personal directive, you're saying, here are my choices for care. We're going to look at that so you'll actually get to see it. But if you have been diagnosed with a serious illness, you take it one step further. And now you're working with a doctor who's medically saying, this is my order. I've talked to my patient. This is what my patient wants. And now I'm going to sign this along with the patient to say every other healthcare professional who you see follows this order. That's the teeth in the MOLS form, because the medical order gets it done. The personal directive is your personal statement, but it doesn't bind your doctor to do it. So in order of, this is a lot of information, but in order of the documents, and actually for today, we're going to look at the healthcare proxy and the personal directive, and then I wanted you to know about these other documents. You don't have to do them. You can, as I said, they're your choice, and you just can add them to your plan as you go. Yes, ma'am. Oh, so there's a question, kind of what happens if you have a healthcare proxy, you've chosen a person, you've done a personal directive, you said, okay, this is what I want for care, but we haven't done a MOLS form, and for some reason, we're at a very life-limiting stage. And it's okay not to have a MOLS form. Here's the way it works in Massachusetts. You have a very strong right to say what you want for care, and if you've written it down, if there's evidence, so to speak, in that personal directive to say, hey, this is what I want, your doctor should follow that. The thing in this state is that they're not legally bound to do it as they are in many other states, but in our experience, the doctors are really welcoming these personal directives. They want them in the medical record because they want to see what you want. They want to know something about you. So if you have a healthcare proxy and a personal directive, you give a copy to your doctor, goes in the medical record, and it comes back up and they can see it, then that should be enough. It could say my wishes are yes. Now let's take a look at the form. It's right there in the personal directive. Yeah, it's a great question. Should I show you the documents and then we can keep asking questions as we go? Again, there won't be a test at the end of today. This is a lot of information that most people don't actually know. So we'll take it slow and everything's on the website. So the Getting Started Toolkit is what you have in front of you. It's a really simple 1, 2, 3 of a kit. You can take one step at a time if you want. The first step is just to choose a healthcare agent, if you can, if you have a person to choose, and write their name in a healthcare proxy. Step 2 is to talk to people, including your family. And this is where we're going to write down our choices for care. That's in that personal directive, right? And then step 3 in that kit is just to make sure whatever documents we do, we walk them right over to our doctor's office or mail them in and say, please put this in my medical record, right? That's the power of these documents. They have to know who to call and what you're saying about what you want for care. So that's the 1, 2, 3. So let's take a deeper look. In step 1, all we're going to do is choose that agent and fill out the healthcare proxy. This is kind of fun to know that in this state, in our law, it actually says the person you choose, that person's actually called your healthcare agent. Makes sense, right? And the document is called the healthcare proxy. And that's why Honoring Choices has focused all our tools around the who's your agent question. Because I'd rather talk to you about who's your person, who's your advocate. What does that person know about what you want for care? And that's why we call it the agent. Yes, oh, okay. So that's what we do across the state, is we have many of our care providers asking this question, who's your agent? And an agent, very simply, is your advocate, right? That's that person you choose, that you trust, who can make decisions, healthcare decisions for you, but only if you can't do it for yourself. So my husband is my healthcare agent, right? And today, if I got a little sick, I have like the flu, I still have my ability to make decisions. He has absolutely no power to say anything to my doctors about my healthcare, right? Even though he's my agent, he doesn't have the power yet to talk to my doctors yet. It's only if I get deep pneumonia and I can't talk to my doctors about what I want, then he can step right up and be there for me. But I'm going to keep retaining my right, so I'm going to get better, right? And the minute I get better, then it's my job again. It's my power to say what I want for care. Some people are afraid if they appoint an agent, we give them too much power. We're only giving them that power when we can't do it for ourselves. Right? Okay. And as we talked about, in this state, we have to appoint. So quick example is a couple years ago, my husband's an avid bike rider. He's one of those guys in spandex you see riding on the roads and try not to hurt. He and his friends were 6 o'clock in the morning riding their bikes through Weston and Wellesley, and he and a friend touched tires. That's all they did, touch tires. And my husband Peter fell off his bike, flew in the air, hit the ground so hard that he shattered his hip, broke his shoulder. His helmet hit so hard it cracked it in half. So he was in trouble. The ambulance took him to Newton Wellesley, and when he could come into consciousness, he'd only ask me, "How's my bike?" and then he'd go back. But he needed to go into surgery really fast because he was bleeding in several places, into his leg, into his head. And the doctor said to me as his wife, "Okay, you have a choice. We have to deal with his hip first. Everything else we can kind of manage. You have a choice to get him hip A, where he will be able to walk again, because he really did a bad thing on his hip, but he won't ride his bike. And B, hip B, he'll be able to ride his bike, but he's going to walk with a limp forever." That was my choice. So this wasn't hard for me. I knew that if I wanted to stay married, right, it was choice B, right? Because he's been riding since he was 2 years old. This makes him happy. So I said, all right, let's go with hip B. Now my 20-year-old son comes in the room and says, "Mom, are you crazy? We got to get hip A so that Dad can walk again." So I saw the doctor's face right away, which was like, oh no, because guess what? My husband hadn't appointed me as his healthcare agent. So I had absolutely no power as his wife to make the deciding decision. My son and I actually had equal right to make a decision for my husband. So unless my husband appointed me in that healthcare proxy, wrote down my name, I didn't have the power to make that decision. So this gets to be really complicated, especially when people get really sick and we're at the end of life. You can imagine how hard this is for families not to have that decision maker, that quarterback, to be able to have the legal power to say, this is what we're going to do. And that's why doing a healthcare proxy is so important, if you can, to appoint that one person to make decisions. Now, I always forget to tell the end of the story, so let me tell you is that what you were going to ask? I know. Everybody wonders. So I knew enough to know the problem, so we sat down, my son and I, we talked it out. We came to one decision to go with hip B so that he'd limp but ride. And of course, I'm still married, so I made the right decision. My husband was very grateful that I did that. And he's fine. He rides every day, still riding the roads, and he does limp. But he said that's exactly what he wanted. So he's good. Other questions?
How is that resolved if neither you nor your son had the authority?
Could get, yeah, right.
Then did your husband make that decision?
Well, my husband couldn't make the decision because he was not able to. So how does it get resolved is a good question. Typically in hospitals, social work is called in. I don't know if anybody's been involved in this, to help get the family together on a family decision. Now, if a family can't decide and we have a real emergency like my husband was in, then guess who decides? The doctor, because he can't let that patient, get hurt. Yeah, so the decision can be taken out of your hands, too, without a healthcare agent. So really, really great to do, really simple to do if you can. So let's go on. So who can be an agent? Really anybody who's 18 and above. It doesn't have to be a family member. It can be a close friend. It can be someone in California, even though it's harder for that person to be here, to be your agent, that's still okay. You get to pick. It just can't be a person who works at a place where you're a patient or a doctor who treats you, unless that person is related to you. And what's an agent do? As we said, that agent makes the decisions you want, not so much what the agent wants, right? So it's really important for me to tell my agent, okay, if I get sick tomorrow, here's what I want you to know. Here's how I'd like you to tell my doctors about me. So it's really important for us to tell the agent what we want so that that agent now, all that agent's doing is saying, okay, here's what Ellen wanted. This is it. I'm going to relay it to you. That's my job. But the agent has a lot of power. They can talk to the doctors. They can look at your records and your tests. They can tell the doctors about what you want, and then who makes the decision, the doctor or the agent? The agent. That's who has the power. Now, you don't want the agent making decisions without doctor's advice, but sometimes the doctor will say, it is your choice. I can do either thing. And then it's the agent who makes that choice. But as I said, if I'm getting better, if this isn't life-threatening, then the minute I'm better, I get to make my own decisions. Yes, sir. To be an agent, yes, you have to be 18 and older. That's all you have to be. Yeah.
It's good for 6 months, 2 years, indefinitely.
How long are the healthcare proxies good for? Indefinitely. Yeah, it's a great thing to know. So on the proxy, which we'll look at in just a minute, you date it. You put the date there so that people know it's real and valid, and then it's good for the rest of your life. Yeah, should you re-sign it? You should definitely relook at it. One of the things we know about healthcare proxies, and we'll take a look, is that really simply people's phone numbers change all the time. So we want to make sure that we have up-to-date information. You can also pick another agent. You're free to do that. This is your healthcare proxy. You can change it every day if you want to. That's the power of that document too. We'll take a look in a minute. I just want to answer this question. Mhm. Oh, this is a great example.
Blah, blah, blah. And so they said, sorry, we don't have it, we can't.
Mhm.
I thought, if, and something could have gone wrong.
Right, let me-
If I hadn't spoken up on
Yes.
the issue. But, so I called my doctor's office. Oh, yes, we have. They get back to me, they called me back. They have it, they just didn't know where.
Oh my. So let me just relate this for the cable audience. So this happens. So this lovely woman shared a story with us about how she'd done a healthcare proxy many years ago, right? And she gave it to her doctor and assumed it was on record. And when she went to have further surgery at a hospital, they couldn't find it. This happens every single day. They can't find the proxy because they've put it in a different place than they think it's going to be. So here's the problem. So if you still have your ability to make decisions, you can make a new healthcare proxy if you want to on the spot, if that's important to do. Sometimes the hospitals will say, we really would like you to do this. Again, it's your choice. You can do it then. Or you can say, wait, my doctor has it, or I have a copy at home. Here's the name of my agent and their phone number. That's good enough. You have a valid healthcare proxy at home or somewhere, filed somewhere, and you could do that also. The end of the story was they were able to find the healthcare proxy. It was just misfiled in the electronic medical record. That's where they filed it. Right, and I guess I'm saying they misfiled it. But what they're doing now is the hospitals are taking another look at their electronic medical records and trying to clean them up, so that many of them now have a tab at the top that actually says Advanced Directives, so that they can file it properly. And so if you go for surgery or treatment, they can find it again. But we've got a long way to go on this, we really do, and it's still up to us to say, do you have my healthcare proxy? Can you show it to me? Is it in my record? And I wouldn't take, yeah, it's there. I'd say, show it to me. And then that gives you a chance to actually look at it and see what they have on file and update it if you want to. It's a big problem, for a state that's got so much technology. We're really way, way behind in being able to just automatically have this, in front of us if we need to. And so I would also recommend, we've learned this from people every day, put it in your pocketbook, put it in your car, carry copies with you so that you can re-give them out. Travel agent? if you trust that person, you get to give it to anybody you want. Yeah, again, sure, it's your choice to do that, to travel agent to anybody you'd like. Why don't we take a look at it? In your packet, by the way, is more information about choosing a healthcare agent. If you're not sure how to do that, there's some information for you. And how to fill out the healthcare proxy. This is all you really need to know as a layperson. If you have more questions, more legal questions, then that's the point to go to an attorney. But you can do this yourself. Let's just take a look at the proxy. This is the Honoring Choices Healthcare Proxy. It's online and very easily downloadable. We have it in 10 languages because we're finding that it's really important that people do this in the language they're comfortable with. And then we've got a lot of our community partners helping people do this. We do it in the language they're comfortable with. Then we find a bilingual person, usually someone right there, to translate it back into English. So both of them can go in the medical record. Really simple. For those of you who haven't done it, want to do it, you can do this yourself. You also can do it with your attorney. It doesn't matter. All you need to do before you do this document, sorry, this is hard to read, but if you look at the hard copy, you can see it, is the name of your agent, right? You fill in, number one is you fill in your name, your address. Number two is you fill in your agent's name. And any way it's best to contact them. Is it cell? Is it home phone? Is it email or text? Sometimes that's the easiest way to get people. So whatever it is however you want those doctors to find your agent, you write that down. It's great to pick a second person as an alternate agent, but you don't have to. And we sometimes it's just hard to find one person. It's difficult to find two. You can always go back and put an alternate in. Now, you're giving the power to this person to make any and all decisions for you, including end-of-life care decisions. But you also have the ability to limit that power for your agent. If you're not sure you want to give your agent all that power, you actually can write that down right in the proxy. Say, they can make all decisions, but let's say if I need to go to a nursing facility, I want the doctor contacted, or you can give instructions, whatever makes you feel good. If we can, it's best to give the agent any and all decisions because we can't always predict what is going to happen with our health care. And we want to give them that power to talk with your doctors and make the best choices for you. And then you're going to sign it, and then you just need to have 2 witnesses with you, okay? The way it works is I sign, and then 2 people will sign right after me in the witnesses. Who can be a witness? Anybody. Anybody who's 18 and above, but not your healthcare agent and not your alternate agent. So typically, if you're doing this at home, you can bring your neighbors in. If you're doing it in your doctor's office, they typically bring the staff in. That's how this works. It does not need to be notarized. At the end of this, you have a legal healthcare proxy right in your hands. Yeah?
Oh, I was wondering if your second, the first person's lost and the second one lives far away, can the doctor just call that person, or does the person have to be there?
So you're talking about healthcare agents. So if you can't find that first healthcare agent, which happens, right? We call and they're not home or they're not able to serve, then we call the alternate agent. And that alternate agent, both of those folks can be anywhere in the United States. The hard part is, I should tell you, this is where we have trouble with the hospitals. We have to give them this credit. They don't know who they're talking to on the other end of the phone. So they have specific policies about what happens when they call an agent, especially who's out of state, who can't come in physically. So it's a good thing to talk about with the doctors, what happens if you call this agent, what information are you going to need to listen to them. I saw another question. Be present. Yeah, so how do we make sure we're not just putting down anybody's name and not actually telling them they're our agent? Right, it's a huge responsibility. So, yeah, we don't, in the law, it doesn't say that agent has to be present for when this happens. But you as the, as the person, want to make sure you do that first, right? Talk to the person. I could have easily said to my husband, do you want to be my healthcare proxy, my agent? And he could have said no. He could have said, that's too much responsibility. I'd rather I did it with me and maybe your sister, who I'm close to, So you definitely don't want to assume people want to be your agent. And yes, it's good to get their information, to tell them what you want for care, and then do the proxy. Other questions? Yeah.
So did you just say that, you said your husband, if he didn't want to do it, that your husband and your sister would make the decision?
It's a possibility. You can have two joint people. So again, what I'm going to say is, and we see this is your document. This is your healthcare proxy. You can appoint whoever makes sense in your life. So yeah, you can appoint two people. It's a little tougher though, right?
So I have my son and daughter down, and I went to another program somewhat like this, and I realized my son is way too emotional,
Yeah.
and I think I'm gonna change
Yeah.
just to have my
Right. So as you think about appointing two, right, the comment is, here's what you have to know about two. Those folks have to both be able to listen to you and say, here's what mom wants in this case, right? And yes, we're both going to agree that we're going to try to get her that care. Because they're co-agents, they have equal power. So the doctors are going to look for one decision from those two people. And if you don't think that's going to work for you, then you're setting up a problem for yourself and for those two people. So change it, right, and go to one agent and one alternate. Yeah, it's a problem. I know for some people who have two children or two people that are important to them, you want to give them equal power, but if they can't agree, even on simple stuff, then it's not going to work. They're not going to be able to really represent what you want for care.
You just don't want to destroy their relationship.
Right, and you don't want to hurt their relationship. Right, actually, really good point. So let's just move along. As I said, your document, you get to make as many copies as you want, by the way. So there's the one you signed, the original. Make as many copies as you want. Those copies are as valid as the original. You want to, as this woman pointed out, you absolutely want to look at that document at least once a year, or when you have a major sickness or major, family upheaval or something in your life. Make sure that's the agent you want. Those are the phone numbers they can get contacted at, and then give out copies. So what we say to folks is primary care doctor, right? Besides the agent, you give a copy. Primary care doctor. Ask your primary care, what are you going to do with this? Put it in my file, but will you send it to the hospital? Will you send it for the hospital records? And I would check with your local hospital. Sometimes the hospitals have main records, and then their emergency room records are really different, and they don't talk to one another. So you could go to the emergency room and say, my healthcare proxy is on file here at the hospital, but they won't be able to access it. So I'm afraid we have to still be detectives a little bit until we get a bigger electronic registry where we can put everything there. But just if you're going to find yourself, if you think you're going to be going to the hospital or the person that you're helping in your family might be doing that. My father was at the end of life. He was sick for a long time, but in the last year, we were at the hospital a lot and in the emergency room a lot. So we made sure that emergency room had his records, so we didn't have to go through the where's your healthcare proxy, where's your DNR every time we went. So you can do that. So a lot of folks can't appoint an agent. Really simple. In Massachusetts, we think it's about 1/3 of the people we talk to. There just isn't anybody there to appoint. Sometimes we outlive our family. Sometimes our friends have moved away. That's okay. And the truth is, we hear this from 18-year-olds and 30-year-olds as well as 60 and 70-year-olds. It's just across the board. It's kind of the society we live in. So it's important for us to say, no agent, no problem. Right now, let's not let that get in the way of you writing down what you want for care. And that's where that personal directive becomes a very important document for people who are not ready to choose or can't choose. We just want to go to the, yes, sir. Yes. Mhm. So if you have your healthcare proxy on your cell phone, I get asked this question frequently. It's always good to, if you want, take a picture of it, put it up there. Here's what we're hearing from, and again, some hospitals will accept that, but only if they can download it and get a paper copy from it. There's nothing in the law right now that says that cell phone is acceptable. But again, this is so different with every hospital and every nursing facility. Sometimes they'll accept that and download it. Always good to have there, though. Yeah. So if you're in a system like Partners Healthcare, would it be able to cover all the hospitals? It's a really good question, and I don't know. And the answer would be, go ask them. If you've got my healthcare proxy at one hospital, can they easily bring it up in other hospitals? I want to say yes, because if they're connected, but I really can't be sure. True for a lot of systems, the systems are getting bigger now. It's a good question. So what happens now? What I'd love to do, Bay State Health out in Springfield took our healthcare proxy and our personal directive and put it on the patient portal. So everybody has a patient portal, right? So what that hospital did is, let's just put it right there for the patient. They can fill it out, they can see it, they can share it with the doctors. So we're trying to encourage every hospital to think about it. It should be pretty simple, right? Those patient portals, they've mastered for letting you know when you have to pay your bills, right? So they should have the healthcare proxy too. We're working on that one. Did I see another question before we go? Did you?
Many doctors serve several hospitals. So if you have your physician generally going to another facility where he or she may be practicing, then that should make no difference.
Right. So the doctors are moving around to different facilities, right?
That's happening more and more.
It is. Yeah, so again, it just keeps us in charge of asking questions. Let's not assume they have our documents. Let's make sure they have them. Excuse me. So step 2, now we'll move a little faster, but the idea is this is such an important document for if you have an agent, great. This is where you tell them what you want for care. If you don't have an agent, it's important to write down what you want for care anyway. That's how the documents work. So a personal directive or anything in the state that's called a living will, that's how we communicate what we want for care. It's not a legal document, though, and so we like to think of it as a personal letter. This is what as you see the pages, it's very much about what matters to you, what's important to you, not just about those medical choices. What do you personally want to tell people about yourself and what to do if you're sick? So that's what the document, personal directive, does. In your packet, you see there's a handout on how to fill out a personal directive. Pretty simple, though. Here's what it looks like. It is 2 pages in its short form. You can do this yourself anytime you want. You can update it, you can change it, you can make a new one, right? This is your document. I think the feelings I had about healthcare when I was 20 are really different now that I'm older and in my 60s, right? Our choices change, we learn more. So what we're going to say about what we want for care, what we value, is going to be different. So this personal directive changes with you as your health needs change over time. We have it in a few languages. The first page is really about, as I said, tell us about what matters to you. What do you value? What would you want me to do if you got sick tomorrow? And we know you're going to get better, but what do you want us to know about you? What's interesting about this, people have been writing down a lot of personal things, like call my sister in Colorado. She's not my agent, but I want her to know that I'm sick. Or could someone take care of my cat? Really basic stuff that people want to feel comforted about is going to been taken care of if they get sick. So it's those personal things, values, religious beliefs, that's page 1. And who do you want me to tell? And your doctors can help with this too. Sometimes they don't have someone to call. So they'll say, oh, look, it's written down here. Let's start the ball rolling. And then on the second page are those medical decisions. And again, these are your choices. Right now, today, I would tell you if you have a life-limiting illness or even a chronic illness, make sure you feel like you have enough information about it from your doctors. And to know then, if I get sick tomorrow, if I have a life-limiting illness and I'm not going to recover, what are my end-of-life care choices? And you can check those boxes. You can change these anytime, right? As we said, this doesn't legally bind your doctors because it's personal, but it gives them a lot of information, doesn't it, about what you want for care. I just recommend you sign it. What we are saying now, it's really nice to put your healthcare proxy and your personal directive together, staple them together, put them together, give them to your doctors. Say, please put this in my record. And then it's your job to remember you want to update them. Okay, that's the important part about this, is that you keep it up to date, right? Because things will probably change over time. Questions about the personal directive? We find too, if you're trying to help a friend or a loved one with these situations, that this is a great document to start a conversation with, because it's really easy. It starts with what's important to you. Not what kind of medical care do you want, but what's important to you. And we find it's been helping our families have conversations with us. A lot of our, let's say, parents and grandparents, I'm in both of those categories now, is if I have my son who's in his early 30s and he's saying, Mom, I don't need to do this. It's actually helped me to say, let's look at mine. Here's what I did. And I want you to know that this is what the kind of care I want if I get sick. But what about you? What about if you get sick? What do you want me to do? And that has been helping to get people to do their documents, just that easy kind of conversation. Yeah? Do all the states have the documents online? I'm not sure how easily accessible they are for all of them. Most of them do. On the Honoring Choices website, we've not only posted the Massachusetts documents, but we've posted all the New England documents, because we find it's sometimes if you're taking a vacation in New Hampshire, right, you want to make sure that your documents are going to be recognized. So we're working with all the New England states on that. They sometimes, it gets a little confusing sometimes if you're in another state to say, well, this isn't our healthcare proxy. But the law says that they should absolutely be honoring your healthcare proxy if it's similar to their law, and it is across New England. It's a little tougher when we go to Florida. It's a little tougher in California to have people honor documents because they're all different. But again, talk to your doctors. You go to Florida 6 months of the year, say, will you honor my Massachusetts healthcare proxy, or should I do a Florida one? 2. So that's that personal directive. As I said, if you've chosen an agent, great. You want to do both documents, right? Choose an agent who's your decision maker, and then tell that agent what you want for care in the personal directive. If you can't choose an agent, no problem. Really, a lot of people have felt very cut out of this process because there's nobody to choose. And that's not the point. The point is that we know what you want for care. So we want people to do personal directives. Your document, you own it. You can change it and share it with whoever you like. So step 3 is the one we probably do most days, right? We talk to our doctors about what we want for care. They call those, of course, goals of care conversation in the medical world. They're important to have. But what we want people to know is advanced directives, like what you have, are not just about end of life. They're about what kind of care do I want today? How do I feel better? How do I improve the quality of my life? Those are what we're finding at Honoring Choices in the last 6 years. We've been carrying these documents, just the sheer fact of giving it to your doctor starts a conversation. And that's been really good for everybody. So what's ahead for me is another big question we hear. We tend to be planners in life, right? I know I have this illness. I'd like to ask you, what's ahead for me? What kind of complications might I see? What's going to happen in the next 5 years? Getting information is something that you can do. In your kit, if you want some questions for how to start a discussion, that's what we've included in there. On the 5 things you can talk to your care providers about, the titles in blue, those are your rights. Your right to information. Your right to say, here's what I believe, my values, my religion, my goals. Let's plan my care around that. And then we make a plan with these documents so that everyone can know our choices and honor the choices. Okay, and as we've said, put those documents into action, give copies, keep a copy, and give them to whoever you want. Get them in your medical record. Now, on our website is the Next Steps Toolkit. So after you've done this, and this is really just the beginning, we want you to build on those discussions and add to your plan. So all of that information is there for you. We have more discussion guides. We have more information on those next 3 documents, the durable power of attorney and the 2 medical documents. Palliative care is a wonderful up-and-coming medicine. Really simply, if you have a serious illness, if you're 12 dealing with leukemia, or if you're 60 dealing with cancer, doesn't matter. You have a serious illness, you can have a team of doctors and nurses and pharmacists, bring them all together. They're the palliative care team. They work with your doctor to say, how do we get this person to have a better quality of life? A lot of times with serious illness, there's more pain, there's more symptoms that are really tough, like sleeplessness and not being able to eat or feeling nauseous, those kinds of things that impact your life every day. The palliative care team gets together and says, what can we do for this person? What added layer of medicine and support can we give them? So if you know someone or you yourself has a serious illness and you're in that situation, you go to your doctor and say, I'd like a palliative care consultation. I'd like to bring in that team and see if I can feel better with living with this serious illness. It's not everywhere. The hospitals usually have palliative care teams, but you can ask your primary care doctor to see what's in the neighborhood. And that's pretty much it. So we want to offer you this toolkit. Everything I said is on the website and it's free and downloadable. We can talk to folks here at Wellesley Council on Aging to see if we can even set up a time for you to do your own healthcare proxy if you haven't done it yet. Sometimes nice to do here, or you can just do it yourself. Just make sure you have those 2 witnesses. Any questions about where we are here? You've all been very thoughtful with your questions today. I hope I didn't overwhelm you with information, but you're way ahead of the curve here, so good job on knowing about your care and taking charge of it. It's not easy to do, it really isn't, but we find having these documents really helps ask our doctors to be more involved with us, to give us better care. Any thoughts? Well, I want to thank you for coming. Thank you, everyone.